everyone, welcome to another episode of Appetite for Discussion TT with me, Karen Das. Joining me today, Dr. Akash Maniam. He's an oncologist. He practices in the UK, but he is also clinical director at the CCRI, which is the Caribbean Cancer Research Institute. Nice to see you again, Dr. Maniam.
Nice to see you too, Karen. Thanks for having me.
So Dr. Maniam and I, for those of you new to these videos, Dr. Maniam and I some time ago embarked on a series of conversations about cancer. And you think you know all about cancer. Let me just tell you, you don't, because we never run short of topics. There's always some different angle, something new that's happening, be it with research or clinical trials or treatment and just technology as well. So that's the purpose of Appetite for Discussion TT with Dr. Maniam. So we look at cancer and it's a broad perspective. So we thank you very much for keeping up with these episodes. Remember, you can also catch up with episodes on Spotify. So you simply look for Appetite for Discussion TT, and there you'll see what we have been working on over the months. So today we want to talk about cancer, yes, but we're going to talk about cancer and mental health. Now, quite often mental health issues are ignored, trivialized, stigmatized, and there are serious consequences to that, not just for patients, but for family members and even for society. So we must keep communicating, we must keep the dialogue going. And so saying that, we must also support the networks and the advocates who work diligently and most times silently, to keep pressing for policy changes and to lend the assistance where needed. And when it comes to cancer, mental health and mental health issues also pop up. So Dr. Maniam, maybe you're the rightest person now to tell us why it's so important for us to discuss mental health and cancer.
Couldn't have put that better myself. It's a great introduction to the field. I think we should always prioritize mental health, full stop. I think in the Caribbean, we don't talk enough about mental health. And we tend to look at things when we're at a crisis point, when something traumatic is happening, or perhaps when someone has attempted to commit suicide or has committed suicide. And I think most people know someone who has done something like that. And when that has happened, we then start wondering, why? What happened? I mean, what was wrong with them? And we ask all these questions that are, I guess, a bit late. Mm-hmm. And we always wonder if we could have recognized the warning signs a lot earlier, or if there were ways that we could have helped. So when we think about cancer, for many people, cancer is the biggest fear that they could have had in their lives. It is a life-changing diagnosis. It is a heavy diagnosis. Even the word, if you tell 100 people the word cancer and you ask them what they think, you're going to get negativity most of the time. It's going to be something heavy like death or terminal or incurable or chemo or side effects or anything like that. So it makes sense that we talk about mental health with cancer, because surely cancer patients are at higher risk for mental illness. Mm-hmm. That is exactly what the data shows. So it's a great place for us to start.
I came across a book. This was written by a well-known journalist here in Trinidad. She's had a 30-year career, and she has written about so many people, and quite often given encouraging words and shared the positive side of someone's story. But then she was placed in a situation where she now needed that kind of encouragement in return. And what did she do? She wrote about it. And she journaled her experience having to cope with a breast cancer diagnosis, going through a double mastectomy, having to deal with her family, trying to explain this to her children, adjusting after treatment, adjusting after a diagnosis. So the book, Once Upon My Chest, Breast Cancer Memoir by Pulu Dani Maharaj, Scarred by Cancer, Blessed with Love. And there are so many lines, I imagine, that will resonate with so many of you. And these lines actually stood out for me when her diagnosis was revealed. Quote unquote, like thunder, The words penetrated my mind. I closed my eyes and I staggered through absolute mental darkness. My life flashed before my eyes. I saw myself in a coffin, and the thought of death jolted me back to reality. I mean, that must be a common response and reaction by patients, by many, many patients. I mean, the shock, the fear, the anxiety as well, Dr. Maniam?
That is beautifully articulated.
Yeah.
I don't want to say enjoy, but I value hearing and reading patient perspectives. Ultimately, they are the truest form of understanding what cancer really means. Shock, I think, is the number one emotion that comes when we're facing someone who is at least recently diagnosed with cancer. What you've said there is really apropos. If we think about cancer and the impact of mental health, it's very useful for us to compartmentalize it into the different stages of the cancer journey. And that'll help us to understand it. So you can have the shock of, oh, I think I might have cancer, or the doctor said, I think this could be cancer. Then when you get the diagnosis to, oh my goodness, I have cancer, to having your first treatment, whether surgery, chemotherapy, radiotherapy, whatever. To, oh my gosh, I've had treatment for cancer. To finding out if you're potentially curable or incurable. If you're not curable, you think, I'm going to die of cancer. This is it. This is what has happened to me. And if you're not going to, or you're going to have a potentially curative treatment, then you think, okay, how bad is this treatment going to be? And it's going to come back at some point anyway, isn't it? Now, whether these are rational or irrational, it's irrelevant. This is just what patients, this is what they feel. This is such a human thing. And then when they finish their treatment, they always just think, am I living on borrowed time? How much longer do I have? You know, any little issue that comes in the future, it's almost like reopening this traumatic wound. It just makes them think, oh, it's the cancer again. And it's like from that moment on, from the time you call someone a cancer patient, everything else just fades into the background. Everything else is in the context of being a cancer patient. You could have had stage 1 breast cancer 20 years ago. The minute you get a little pain in your breast, you think, oh, this is it, it's coming back. Even for someone who is cured, far less for someone who is dealing with deadly cancer with only a few months to live. So across the journey, across the spectrum, that shock is really, it's all pervasive, and it's coupled usually with fear and anxiety. So exactly what was described there so eloquently, I think it really captures how most patients feel, even if initially they present quite stoic fronts, they're still terrified underneath. So that, I think, is, really beautifully said. I think I would recommend that to people to read for sure.
Oh yeah, so it's Once Upon My Chest, a breast cancer memoir. And she's been working for a long time. She was recognized with the national award, the Hummingbird Medal, for her contribution to journalism. So she certainly knows how to put words together and really make it real for so many others, because it was real for her. But you listening to you just now, this is what happens to a patient. What happens to that person, what's happening in their mind, and everything else through that person. And there's a conversation that takes place in that person's mind. You know what doesn't help? When other people tell you the same thing.
It often doesn't help no matter what they tell you. They can tell you a different thing or the same thing. If they tell you the same thing, it is stressful. I think, we've covered this in previous talks. It's very important for patients to try to shut the noise out and just focus on their own journey, because ultimately, most people around you mean well. Most people. This is not to disparage anybody, but ultimately, as the patient, this is your fight. It is your journey. You're the most important person. So you need to put yourself first and prioritize yourself. And just like a 100-meter runner might take a deep breath in, close their eyes, and just meditate for a second before taking that run, just to shut out everything else around, just to get in the right headspace. As a patient, you need to take that time. Processing a cancer diagnosis takes time and reflection. Understanding it takes time. Coming to terms with the rapid fire medical information you're being given in a clinic room takes time. And even though people might mean well around you, even if they have very similar experiences, some of them might have had the same cancer or been through the same sorts of drugs or surgery, it's not your experience, and it will never be the same for you. And if they tell you, don't have surgery, my neighbor died after surgery, that's not helpful. If they say, surgery was easy, I was cured, don't worry about it, that's not helpful, because we don't know what yours will be like. If you have a worse experience, you might just feel like you were robbed of something or you were cheated of it. And if you have a better experience, you then start wondering if what you had was really the same treatment and if the other person just had a terrible time. Either way, it really affects people when they hear stories from others. That's not to say that there isn't merit in reading stories exactly like what this book is saying. And for instance, on the CCRI page, one could read these sorts of stories. It's just important not to have people tell you how something is going to go and what your experience would be like. You could read their experience and just treat it as reading a news article or just reading a fiction book or something else. Just you're reading it and you're taking what you can from it, but don't take it as a prescription for what your life will be and what your cancer journey will be, because no one can tell you that. And as physicians, we can only tell you how the average person would do, what the clinical trial data is, what our experience is. But if 1% of people with a certain diagnosis survive for 5 years, we don't know if you're going to be that 1% or the 99%. We just never know what you will be like. And we're always trying to straddle this tightrope between not giving you false hope, but still trying to give you some hope.
Yes.
So no, I completely hear what you're saying. Sometimes when other people tell you that, it can overwhelm. It can definitely overwhelm.
Do we have statistics on how prevalent clinical depression is among cancer patients?
We do. Generally speaking, you're looking at between 30 and 40% of patients with cancer having a mental health illness of some sort. Depression, the most common, anxiety, not far behind. But when you think about that, you're talking about 1 in 3 people, sometimes as much as 1 in 2. That is not people who feel sad or fearful. This is people who actually have a mental health illness. That is shocking. That is really high. It is clearly a large area of unmet need, because clearly these patients need much more support from the healthcare institutions, from society, from patient groups, from navigation. Clearly we're not doing something right as a society, because this data is not unique to one country. This is data that's consistent across many different places and many different types of countries with different access to healthcare, etc. But that is the data. There's also data showing that people with cancer diagnoses have a higher suicide risk, which again makes sense given that they have a higher burden of anxiety and depression. But given that cancer treatments have come such a long way, as we've discussed before, the focus has to shift then on these types of issues, because if we're going to cure breast cancer, but you die by suicide or you just live a life of misery, then we have failed. We have failed. We haven't actually helped this person. We've just prolonged life, which is really not what we're looking to do. But that is the data. That is the data that we have.
And how does this affect treatment?
It affects treatment profoundly. Honestly, mental health affects everything in life. And we take it for granted. If someone, let's say a footballer, breaks their leg, you just think, all right, well, look, the doctor said they'll be out for 6 months and they'll be running, they'll be playing again, and then they get back. What we don't see is what they do one-on-one with the trainers, the physios, and what they do with themselves, the sheer burden of, psychology. It's a lot of hard work, a lot of discipline, a lot of dedication. If you have cancer and you're going through chemotherapy and you're depressed, you're much more likely to have a tough time. You're more likely to have extra side effects of chemotherapy. You're more likely to take longer to recover. Because when you're depressed, your appetite may change. You might start eating unhealthily or not at all. You might just start giving up. You might not attend your appointments, and you might start missing treatments. Or you might even just take the tablets at home and not actually take them. You just take the prescription and you don't take them. And these things all happen. We all have stories of patients like that. So the outcomes are always going to be worse. The experience with cancer is going to be worse. So it is really difficult.
All right, so let's just build a scenario. Someone is in your office, and I know we discussed this in a previous episode, but not via video. So someone is in your office, and you have to deliver the results of their tests, and you have that conversation with the person. What should that person do from there?
I think the most important thing for them to do is to take the discussion at the pace that they feel comfortable with. We always have an agenda in medicine. We have fixed time slots for patients. We need to get through X number of patients in a clinic. And if it's a 40-minute appointment for a new patient and you're taking 2 hours to see them, then obviously you're compromising care on the back end for the other people waiting. That doesn't mean these conversations should be rushed, especially the first one. Especially the first one where you're introducing yourself and you're letting them know that they are going to be in your hands and that you're going to navigate them through their journey. Whether that's the surgeon initially or the radiation oncologist or the medical oncologist, it doesn't matter. Whoever's seeing them at that point in time, it's very important to take the time. So if you tell them slowly and gently, you have cancer, I will often take a pause right there and just see how they react. Because often you would just see patients completely shut down. Mm-hmm. The word hits like a ton of bricks, they shut down. So if you start saying, okay, it's stage 2 breast cancer, it's hormone receptor positive, you're going to need this treatment, that doesn't even land. Those words just fall somewhere on the floor. And then what are you really achieving? So I always stop. And then I say, do you feel comfortable discussing the next steps in your treatment? Do you feel ready to have this conversation today? How much do you understand about what I have just said? And I allow them the chance to respond. And then based on their response, I can gauge how quickly to proceed, or if what I'm saying is too technical and I need to simplify it, or if they're just with it and they're ready to go full speed ahead because they've already done their reading, they know what they're going to do. None of these are better than others. If patients come completely unprepared or come prepared, that's all fine. You just have to take it, because often they'll break down at the end. They'll be stoic. They'll take all the information. They'll sign the consent forms. They'll be ready to go. And then at the end, when everyone stops, they start crying. They start understanding the severity of what's happened emotionally. Because some of these are patients who are going to be cured 99% of the time. But from a physician's standpoint, we think, oh, you're going to be cured. It's simple. This should be an easy conversation compared to the person who is dying. It doesn't work like that. It doesn't work like that at all. Cancer means cancer to anybody, no matter what. So taking the time and respecting their process, respecting how much time they need is important. And respecting that we don't have the time all day to speak about it. If patients are not ready, I'll say, look, take your time. I'll often have them speak to the nurse, their nurse specialist a bit more. I'll say, how about we pick this up next week? Maybe you want to bring a certain relative with you. Maybe you'll feel more comfortable then. Maybe you'll take some information, some written information from a trusted source that we would give to them. Maybe you want to read about it and come back and talk with us another day. And some patients take up that option. So if you're a patient and you're going to go through this, do it on your time frame.
Yeah.
That's the most important thing. Otherwise, it'll just overwhelm.
Well, before we wrap up, what about some coping strategies outside of, what we just spoke about? I mean, in general, cancer patients viewing or listening, or even, they're supporting someone in the home with cancer. I mean, what are some basic strategies you can share with us as an oncologist?
Okay. Well, for patients, I think having a holistic approach is the most important thing. So you often will need multiple different things to try and address your mental health. Some of them are simple but not necessarily easy. Trying to stick to a healthy diet. Trying to keep active and have a healthy exercise pattern. Exercise is usually good for your mood and your well-being. It's also good for your general health and your self-image, your sense of self. Socializing, and I'll put an asterisk by that because obviously sometimes you just want to process this yourself. But choosing when to socialize and with whom you want to socialize, that is the most important. If you just want to tell your partner, your spouse, your child, your parent, that's fine. If you want to tell the whole neighborhood, that's fine. People are different. But having a social network is very important. On the medical side, sharing your concerns with your doctor, your nurse, specialist, very important. There are often psychologists who specialize in treating patients who are going through a cancer diagnosis, who might be able to give you talking therapies and psychological advice. Simple things like mindfulness, deep breathing exercises, meditation, yoga, whatever else. And then you have the psychiatric side of things, where sometimes you might need medication to help deal with it. And that's okay too. Often you will need a combination of these things. Going onto trusted websites and trusted sources of information, it's very important. Going on to trusted patient group pages and patient message boards, patient fora, that can be very important because then you feel like you're not alone. I think a combination of these things will get you very far. But most importantly, just not putting up with more than you can actually handle and just being honest. If you're struggling, just say you're struggling. No one's going to judge you. Don't pretend that you're not struggling and just keep going and going and going, because that's when you run into trouble. For caregivers and loved ones, relatives, people who are helping others, I would say the most important thing that we can do is just to take a step back and be patient. We have an instinct as people who care about others to want to do everything for them.
Mm-hmm.
Say, have you tried this? Have you read this? Maybe you should do this. Maybe you should take this class or that. Maybe you should eat this or don't eat this. That can be very harmful. It can be very overwhelming. We just need to let them know we're there for them. And if they need us, they can call us for anything. Sometimes it's even just practical support. Like, can you pick up my groceries? Can you take my kids to school? Just let them know you're there for them. That's often enough.
Yeah.
If they're not ready to talk about it, just don't lead those conversations. Let them lead it for you. I think that's the most important thing that you can do to help someone going through what is a traumatic process.
Acceptance is a big part of it. Some people can go through a diagnosis, they go through the treatment, they just go with it. They go, okay, so I'm supposed to keep up with this appointment, I'm going here, I'm doing this, but accepting the situation. I mean, it is a big burden, really.
It is.
But at the same time, once you accept it, it can also be a relief because you're taking something that you've been carrying for a long time. And a lot of mental health experts will tell you how important it is to just accept a situation. And that way you're able to think clearly, you're able to retain proper information, think logically about things, make proper decisions. But if you don't actually accept your situation, it's really difficult to do any of these coping strategies because you'd just be, piling on more stress.
Completely agreed. Confronting the reality is hard. It is hard, but it is the only way to try and make sense of it all. It is happening. Okay, this is my diagnosis. This is my treatment. what can I do next? What is within my control and what is not within my control? And trying to focus on what you can actually influence. Because some things like whether the cancer will come back, there's just a lot that you can't do. But you can have the treatment. You can lead a healthier life and you can give yourself the best chance. So what next?
And this takes time. It's not something that you can do overnight. Obviously, it takes time. And that's why it's important for you, listener, as well as viewer, that if you find it to be overwhelming, that you reach out to a professional that you can talk to, so who can actually guide you through the process, and you don't have to do this on your own. And that's why we started the episode by saying thank you to the support groups and networks. There's so many people who are working, and they're there to provide that sort of support. Something else that you can do as a coping strategy, you can write, like Puludani Maharaj. Now she has a way with words because she's a journalist, but it's your journal. So you write what you feel. Writing is cathartic. You can get a lot of things out when you write, and who knows, it might just be a memoir like this, and it might be a huge source of inspiration for others just like yourself. So that in itself is also something that can give you motivation and can make you feel a little better as well. And there's the CCRI. They have some posts, they have blogs, and they have their services available. So Dr. Maniam, just tell us briefly how folks can get in touch with the CCRI.
Sure. Yeah, you're completely right. There are patient stories available there as well. The simplest way is to go to the website, which is the ccrinstitute.org. You'll find all the information there. But if you wanted to reach out by phone, then it's 610-8378. That's if you're in Trinidad. Otherwise, it's 1868 before that. That would be the easiest way. But yeah, everything you said there, I completely agree with. You don't need to publish your memoirs. You can even just burn it up if you want, but just get it out of your head somehow, and getting it onto paper in whatever form, however blunt, just put it on paper, get it out of your mind. It's great advice. Yeah, it's great advice.
And a lot of good advice coming through these episodes. So I want to say thank you very much, Oncologist Dr. Akash Maniam, for being my guest on Appetite for Discussion TT. Dr. Maniam practices in the UK, but he's clinical director at the CCRI as well, the Caribbean Cancer Research Institute. So we'll have more episodes for you as we go along, because we all have this appetite for discussion TT. So I'm Karen Das. Thank you once again, Dr. Maniam.
Anytime. Thank you for having me.